Hi, I'm Emma Sterling, and I've been working as a healthcare assistant in the UK for about 6 years. Today, we're joined by Mr. Jonathan, a medical assistant from the NHS. Let's talk about an important topic, an introduction to health and social care. Welcome, Jonathan.
Hello, Emma. Thanks for inviting me. It's great to be here. Health and social care is such a broad and vital area, and I think it's really worth understanding what it involves.
Absolutely. So let's start with the basics. When we say health and social care, we're talking about services that support people's physical, mental, and social well-being. It's not just hospitals and doctors. It also includes care homes, community support, social workers, and many other services that help people live healthier and more independent lives.
That's right. Healthcare focuses more on treating illness and maintaining physical health. Things like visiting a GP, getting hospital treatment, or taking medication. On the other hand, social care supports people in their day-to-day living, especially those who may have disabilities, long-term conditions, or difficulties managing on their own, such as the elderly or vulnerable individuals.
Yes, and both areas work closely together. For instance, when an elderly patient is discharged from hospital, health and social care teams collaborate to ensure that person receives proper home support, medication, and assistance with daily activities. This kind of coordination is crucial.
Exactly. Integration between health and social care helps prevent people from falling through the cracks. The NHS and local councils often work together to make sure services are connected and person-centered. The goal is always to give individuals dignity, respect, and independence wherever possible.
And let's not forget the values and principles that underpin this field: compassion, equality, confidentiality, and promoting independence. As professionals, we must treat every person as an individual and respect their rights and choices.
That's so true. Communication also plays a huge role. Whether you're a doctor, nurse, care worker, or support assistant, being able to listen actively and communicate clearly is key. Many service users might be anxious, unwell, or have communication difficulties, so patience and empathy are essential skills.
I completely agree. Another important aspect is safeguarding. Health and social care workers have a duty to protect people from abuse, neglect, or harm. That means being aware of the signs, reporting concerns, and following proper procedures to keep everyone safe.
Yes, safeguarding is at the heart of what we do. And continuous professional development is also vital. The sector keeps evolving with new policies, technologies, and care approaches, so workers must keep learning and updating their skills.
That's why training programs and qualifications like NVQs or diplomas in health and social care are so valuable. They prepare workers to understand legislation, ethics, and practical care techniques, whether it's moving and handling, infection control, or person-centered planning.
Exactly. And beyond the technical skills, I think what truly makes a difference is the human touch. Many people we support just need someone to listen, understand, and treat them with kindness. That emotional support often makes as much difference as the medical treatment itself.
Well said, Jonathan. Health and social care is really about improving quality of life, not just curing illness. It's a field built on empathy, teamwork, and the belief that everyone deserves to live with dignity.
Absolutely. And with an aging population and growing health challenges, this sector